Welcome, everybody. This is Doug McCall from the International School Health Network. Pleased to be welcoming people to the May meeting of the FRESH Coordinating Committee, Partners meeting. We're pleased to be offering this open part of the meeting to discuss the topic of COVID-19 with several speakers. And so we'll be going through that discussion for, we think, about 60 minutes, and then we'll have another half hour for the regular business. And if you want to stay online, there's nothing secret or very, well, actually very interesting. Fresh meetings are always very interesting, but if you wanted to click off after the 60 minutes, that's fine. So I'm going to go through the speakers that you see on the screen under item 2 with Antonio. Deepika, as I was indicating earlier, has had a family emergency, so is not able to join us. Christoph is here. Bella, I think, is here. Mohini will be joining us a little bit later, and Mervat is online as well. So pleased to be welcoming everybody. And as I said, the intention of this meeting is to, first of all, learn about the key initiatives that are going on with the reopening of schools under COVID-19. And so we have several documents that are going to be linked in the FRESH webinars page, but I'll try to share my screen with Antonia to see if we can have that visual aid. But it should work, so I'll just share my screen now and then go to that page. I'm hoping everybody is seeing the Education International Guidance document. Antonia, can you just indicate if you are seeing that?
Yeah, I can see it.
Okay, good. All right, Antonia, if you wanted to start us out.
Yes, sure. I will do that. So, hi everyone. Good morning, good afternoon, good evening, depending on where in the world you are. So, Education International, as many of you will know, is the voice of teachers and education support personnel, representing more than 30 million of them across the globe. And our members have, of course, been faced with a rather extreme set of working conditions, circumstances over the past 2 months. And initially, as the pandemic was moving across the globe, it was much about that somehow emergency response and dealing with all of the teaching and learning very, very suddenly, in many cases, being shifted online. In most cases, education systems did not have plans in place, any preparedness for such a rapid shift. And as we all know, there's a lot of talk about ICT skills and about technology, but in practice, these skills, access to the technology, internet access, all of that is much less equally shared than it should be. So systems were struggling, teachers were struggling, students were struggling, parents were struggling, and really in the first month, first 2 months possibly even, it was all about how do we support members as they are navigating this new normal, and as what started off as a week or two ended up being a month, 6 weeks, and what we've seen, I think, is teachers and education support personnel going well beyond any job description. What we've seen is that the inequity of education systems that we've all been aware of has been proven time and time again, been made visible.
Just, Antonio, excuse me, if people could make sure your microphones are off, we're getting some background noise. So if we just make sure you click on your mic and have the little bar across it. Thanks. Go ahead, Antonia.
Thanks. So at the same time, as we were somehow responding to the emergency, there were also in several countries starting to be talk about the when and if and how of reopening schools and education institutions. And this seemed to us a crucial moment to really look at how educators and their unions could make themselves heard. We don't have the full data, but our sense is that quite few teachers, quite few of the education unions were consulted and involved when schools were closed, and there was much, much less dialogue with education authorities than there should have been. And what we really thought was that now was the moment to look at how unions can contribute in a constructive way, really a moment where the necessity of working with unions is being made clear. It's of course a challenging moment to navigate in the sense that different countries are finding themselves in very different moments. Some are still in very much of a kind of emergency response mode. Other countries have already reopened most of their schools and education institutions. But what we decided to do was develop a set of 5 pillars, issues that we thought had to be discussed, reflected upon, and addressed before schools and education institutions could be reopened. All of this is, of course, and I want to underline that from the very start, all of this is, of course, in respect of the WHO and other health authorities, whatever national context and kind of guidelines and conditions that have been put in place from the health side. But this is looking at the education side of things and looking at how that transition back to on-site teaching and learning can be made as smooth as possible. So I thought I would just talk you through these 5 pillars, maybe focusing on the first and the fifth, as I think they are maybe discussed less than those 3 in the middle. So the first pillar is about engaging in social and policy dialogue. As I said, this really came from the sense that teachers, education support personnel, and their organizations were not allowed to play the kind of a constructive role that they wanted to play. We, of course, would argue that working with teachers and their unions is a precondition for finding the best ways forward, that teachers would have a perspective that nobody else has, and thereby would be able to also spot solutions, identify different ways of going about something than those who do not work in schools and education institutions on a daily basis. So the necessity to consult, engage in dialogue with educators on all of the health and safety measures, but also the whole framework for that transition back to school. Part of this is, of course, about working conditions. It is about the fact that if you open schools and there are a lot of extra hygiene and health and safety requirements, it needs to be clear who's in charge of meeting those requirements. So in Denmark, for instance, there's been additional cleaning staff hired, but that then requires clarity as to who's doing these different roles, and highlighting, of course, the labor rights, the working conditions of teachers and education support personnel. And I want to mention that we do see a lot of layoffs, particularly in higher education, staff that were on short-term or temporary contracts, and then particularly among what we call education support personnel. So that would be all the different roles in education that are not teachers, but still are crucial parts of school communities. So this would range from bus drivers to janitors to those working in food services, but also school nurses, school secretaries, all the counseling services, the librarians. So a broad school community, and we've seen a lot of colleagues being made redundant and losing their jobs as a direct consequence of COVID-19. The second one is an obvious one, ensuring the health and safety of education communities. This will not surprise anyone as a condition here on the list, but here focusing on the need for both agreement and clarity on the measures that need to be in place. Looking at how we make sure that schools are equipped, practically speaking, that there is soap, that there is disinfectant, and so on. And an extra mention, of course, of the necessity to train staff and make sure that they also have whatever personal protective equipment, if that is deemed necessary in their context. Again, we're seeing quite a lot of diversity in terms of how countries and schools go about this. And of course, highlighting that additional funds and staffing has to be ensured in case that is necessary to meet the health and safety requirements. The third one is looking at equity. What we're seeing is a refreshing number of actors, institutions, organizations talking about the equity impact of the school closures. Also, less expected people have had, or organizations have had, equity really front and center of their responses. I just saw some like McKinsey ads in my Twitter feed yesterday, also talking about equity, and was thinking to myself that it's interesting how equity also in much of the news coverage has been a very central piece. But the question is then, of course, what do we do with this knowledge as schools are transitioning back to on-site learning, and what are the support structures put in place to support those who have had a tough time? How do we reach out to those who may never again come back to school? This is about early school leavers, but it's also about all of those at risk of child labor, child marriage. We've seen the evidence from the Ebola outbreak, for instance, where there was a great rise in undesired adolescent pregnancies, for instance. So the link between somehow school closures and some of the violence, the unsafety that some of these children and young people will be faced with, and the necessity for authorities to really commit to something beyond just references to equity in speeches, really looking in practice at how a system deals with those groups deemed vulnerable, marginalized in that context. And then the fourth one is about the physical and emotional well-being and recovery. We know that some communities have had very, very high death rates, that many, both children, students, and staff will come back to school having lost someone close. This again, it goes back to what I said about violence before, and how home isn't a safe space for everyone, how many will have been very, very vulnerable throughout these school closures. So just looking at how schools support mental health to start with, but in this particular case, how do we support the recovery, and how do we deal with the fact that for many, the trauma experienced during these months, it may show up, be visible only later this autumn. There might be quite a hangover, if I can use such an expression, to somehow capture the mental health issues that we may see in the autumn, for instance. So really the necessity to look at how schools prepare for this, what kinds of measures are put in place. Here, I'd make a mention of school nurses and school psychologists, counselors as well, something that many school systems did have at some point, but these were roles that were made redundant as costs were cut and systems supposedly made more efficient. And then the last one is about the professionalism of educators, the need to trust the workforce, to know what needs to be done, really recognizing that teachers are those best placed to determine how we pedagogically meet students as they transition back to face-to-face learning. Again, it's about education authorities engaging with the profession, agreeing on measures to be put in place, but it's also about education authorities respecting the professional autonomy of teachers to make some of these decisions in the classroom. We also make a specific mention of testing, assessment. Of course, many systems today are built around different high-stakes tests. And for certain year groups, these tests are actually determining their ability to move forward in the education system if they are planning on continuing their studies. So the necessity to have clarity on what happens with such tests and ensure that students are treated equally and without any discrimination, regardless of which school they go to and the extent to which they've been able to participate in any of the online learning, if there's been any such learning organized over the past 2-3 months, which of course, and that's probably important to mention here at the end, it is of course the case that some systems have been able to reach out to children, students regularly and keep up both education and some of that broader social interaction, while other systems haven't been able to do that. And that means that we've had great inequality in terms of what kind of education students have had in the past 2 months. But I guess that's something all of you are familiar with. So I'll stop here and I'd be happy to answer any questions in case you have any. Thanks.
So let's take a moment to, I'm going to re-upload the slides and any questions or comments for Antonia on the 5 principles that she's presented? I'm hoping that the slides are, yeah, it looks like we're coming back up with the slides. So I just wanted to, I think in our discussions by email, Antonio, there is a survey that EI did. Is that going to be available to on your website at one point?
I'd like to say that it already is available, because I think it is, but I can check that and I can also share that with you. It is, though, a survey that was done in really the first weeks of the outbreak, and what we've found is that in a way it doesn't answer some of the questions that we would be the most interested in having answered at this stage of responding to the pandemic. So we're already discussing the next stage and whether we should do a follow-up survey to look at some of the other components. But I'll share that with you.
Okay, thank you. And we'll put it in the on the Fresh Webinars page. You'll be able to find that link there. Thank you, Antonia. A good start to the session. As I indicated earlier, Deepika Sharma from UNICEF has had a family emergency, so is not able to join us today. But Christoph, if your slides should be showing, and if you think it's safer for rather than giving you control of them, I'll just click at your request to advance them through the session.
Yes, that's fine.
Okay. Great. If this is Christoph Coronel from UNESCO. Christoph, if you want to just take us through some of the many initiatives that UNESCO has been involved in, along with other UN partners.
Yes, thank you, Doug. So good afternoon or good morning or good evening. So yeah, I'm going to present The main initiatives are related to the reopening of schools in which UNESCO has been involved in the last couple of months. I want to stress that I will focus only on those initiatives developed and implemented at global level, as there are many more initiatives that UNESCO field offices and institutes have been implementing in other regions, in several regions, for example, Asia, Latin America, Central Asia, Eastern Europe. And I want to emphasize that I will present only those aspects that are directly linked to health and well-being because of the nature of FRESH and of this working group, acknowledging that, of course, UNESCO supports its member states in reopening schools first from an educational perspective because of our mandate. So if I can have the second slide, please. Doug, can I have the following slide?
Sorry, just I was trying to do something else. Can't do two things at once. Here we go.
Okay, so I think that most of you are familiar with this document, with this framework for reopening schools that was developed jointly by UNESCO, UNICEF, the World Bank, and the World Food Programme. So you can see on the slide the cover page of this 5-page document that was published back in April. And I'm just going to summarize very briefly what is of interest to us in terms of school health, or health and well-being in general. So, as you may know, the document describes principles and provides practical advice on reopening schools, distinguishing 3 phases. So the first one is prior to reopening. The second one is the reopening process. And then the third phase is once schools are reopened. And for those 3 phases, principles and practical guidelines are organized according to 6 key dimensions. And there are 2 dimensions that are clearly linked to health and school health. So one is well-being and protection, and another one is safe operations. So I try to include here some examples of what is covered by these 2 key dimensions. So, for example, for the dimension of safe operations, well, the principles and advice are based on what has been produced by the Interagency Standing Committee, IASC, for COVID-19. So you will see in the document that this is very detailed, very practical. And for the dimension of well-being and protection, I will give a couple of examples of what is recommended. So, for example, for the phase of the reopening process, the framework emphasizes the importance of the provision of mental health and psychosocial services, not just for learners, but also for parents and also teachers. We just heard from EI, and obviously the mental health of teachers and other school personnel is very important. Another important component of well-being and protection during that phase is the re-establishment of critical services such as school feeding, wash, amongst others. And then when it comes to the phase when schools are already reopened, and in relation to well-being and protection, the framework stresses the importance of providing accurate information to learners, school personnel, the whole school community, in order to address fear and anxiety. And another recommendation, not the only one, is to strengthen referral systems to address problems of physical and mental health. And we know, working on FRESH, that the idea of, school health services, whether based in schools or outside the schools, is really important. So that's just in a nutshell what this framework is about, at least from the perspective of health and school health. So Doug, if you can now give me the first slide. Yes, so this is another document that was produced by the UNESCO Institute, the IEP. And it's titled, as you can see, Prepare for School Reopening. So I'm not sure that all of you have seen this document. It's part of a series of 5 documents. It's for education planners and other education policymakers who are the main audience of the IEP. And it includes 3 sections, as you can see on the slide. And I mean, this document focuses clearly on educational issues linked to the reopening of schools. However, there are some references to health under the first section, plan for the reopening of schools, and particularly under infrastructure. And I included one example on the need to renovate, improve or install hygiene facilities and provide running water, as well as, for example, soap and disposable hand towels. So it's interesting to see that this document, which is mostly for education planners, when it comes to school health, focuses very much on infrastructure. The first slide, please. So, I mean, although I said that UNESCO has approached the issue of the reopening schools first from an educational perspective because of our mandate, I mean, it's worth noting that we see health and well-being as a priority. I mean, our ADG, our Assistant Director General for Education, Ms. Stefania Giannini, published an article which is available on our website, in which she clearly says that learning is, of course, a priority, but the health and well-being of school communities is also a priority to us. And I think it's very important to mention, I mean, for people on this call. And the section of health and education in which I work organized a few weeks ago a webinar which was titled Maintaining Learner Health and Well-being During School Closure and Reopening, which was part of the education webinars, webinars organized by the education sector. And we we invited stakeholders from different regions, education stakeholders who explained how they are addressing issues related to health and well-being. And the recording of this webinar is still available if you want to listen. I mean, there were especially some people from ministries of education who really presented very concrete measures that they've been taking during school closure and also during reopening. And now the last slide, please. Okay, so I would like to mention something that UNESCO and other members of the Safe to Learn campaign have done to help countries prevent and address violence against children in the context of the COVID-19 pandemic. Again, Antonia just before mentioned all these issues of violence that, I mean, we knew from previous pandemics or epidemics like Ebola, but we have been able to document lots of anecdotal data during the COVID-19 pandemic about the violence that has been experienced by children, for example, children at home. So we published 3 documents, 2 of them on protecting children online, and a 3rd document on preventing and responding to violence in all learning environments, including the home. We know again that there's been an increase in different forms of violence affecting children staying at home because of the lockdown. And we know that some children, for example, were more exposed to violence online, including bullying, or sexual exploitation, I mean cyberbullying, because they spent more time bullying. And we know, I mean, just very recently, that on the contrary, some children who were bullied at school found that being away from school was a relief, and now they fear going back to school. So that's why we are, this is one of the issues that we're going to include in a fourth resource that will be publishing very soon. We're developing now with partners including UNICEF, the Global Partnership to End Violence Against Children, and other organizations who are members of the Safe to Learn campaign. So very briefly, these are some of the main initiatives in which UNESCO has been involved, I mean, in relation to the reopening of school. Thanks a lot.
Thank you, Christophe. Any questions or comments for Christophe? And we will be posting the links that are appearing in the slides as well in the webinars page on the Fresh Partners website. Questions or comments? Okay, maybe we can save them for the end. I do hope we can have a discussion about it. It's going to be a kind of an overwhelming session with the amount of information that's being produced, but I'm hoping that we will have a discussion of is there any gaps that people seem to be that are appearing that people are seeing. So Bella and Mohini, I see in the dialogue box you've been posting different links, but Bella, do you want to start it out? And if you wanted to share with Mohini, please jump in. Bella works with the German Development Agency, GIZ, and Mohini works with Safe the Children. Bella?
Yeah. Can you hear me? Yes. Right?
Yes.
Can you hear me? Yeah. I think it would be nice if you can upload. I sent that to you, the 10 action points.
Okay, I'll do it as quickly as I can.
Might be better than mine.
Or Doug, if you would like to make us presenters, we're attendees. So
okay, sure. Okay, let's just do that. Might be the easy way. Where are we here? Bella?
Yeah, I could present the 10 immediate action points and then...
Okay, there we go. I've made Bella a presenter. You should be notified that there is a...
I did that now. Can you see that?
Unless you're on a Mac, which sometimes it doesn't work.
Okay, but I send it also to you so you can use it. Or
I'm going to see if you can do it as well.
Say a few words.
Go ahead.
Beforehand. Yes. I would like to briefly present the work done by the Wash in Schools Network. The Wash in Schools Network is the group which organizes regular the international learning exchange and which work together since roughly 8 years on bringing or combining or bringing together government representatives and partner agencies to update each other and work together on Wash in Schools. There's a very loud background noise. Maybe somebody hasn't muted. Yeah, thanks. Yes, that's easier. Thank you so much. And this group works also together to see once a year, but also to mainstream strategies and to seek agreement to really do not confuse our government partners, but speak with one voice to the government partners and work and go into one direction, reaching the SDGs for Wash in Schools. You can see in the organizations that's GIZ, that's UNICEF, Save the Children, Water Aid, among many others. But this is, let's say, the steering group of this bigger network. The group.
Bella, apologies, we're unable to see your screen if you're presenting.
Okay, I do that off. Yeah, but I shared my screen, but it seems it's not coming in, right? Could you?
Doug, you're still presenting. That's why I guess it shows on the panel that you're. Now I see Bella. Thank you.
Yeah, I think it's loading now.
No, we can't see the screen, yes.
Okay.
Here we go.
It's coming up.
Yeah. Okay. I cannot, can you see it now? So it's 10 immediate Wash in Schools or WINS actions. This is on a one-pager which aims for supporting school heads on the ground to really manage the response to COVID-19 and come up with a one-pager for schools to understand what they have to do now and how to act. And it's very simple, just 10 action points on really preparing hand washing station, make sure kids can wash hands, because it is also a sort of an amalgate of what all the recommendations coming from various agencies, which is really a jungle to help and bring that down to a one-pager to orient on school ground. So it's for hand washing, then also to see, make sure you have hand washing stations and make sure that kids wash hands prior to, when they come from home, prior to starting class. Look and check if you have hand washing and more cleaning and disinfection going on. You will need more water. Make sure that you have enough water to really sustain the school opening. So perhaps you need storage or get in contact with your local government unit or bring in the community to have water available. It is very important to check the supplies, so what you really need have, as mentioned before, I think it's all these aspects have been mentioned before, but it is sort of a one-pager. Then be very clear on the cleaning and disinfecting. Look for the very clear thing on waste management, how you have to do that. And this is followed by physical distancing. Make sure that kids keep physical distancing. Important to establish a monitoring team. And that is important, that a team will check these different interventions and also see if and come up with a way to check if these aspects have been implemented. And that is also, then you have very clear, you need orientation and training. Make sure you're ready with this. Orient your teachers, orient the community, and also for the kids, use age-appropriate hygiene material, prevention material, and also material to orient them what's going on in the school. Super important is also that you help to have checklists, because only when you have checklists, you have an idea that these aspects will be followed up. And then there is a recommendation to have at least 3 areas on locations where you have checklists. You have checklists at the school entrance to look for the hand washing behavior prior to start of classes, sometimes prior to entering school premises, or in other areas prior to starting lessons in the class. You need something, checklist on the classroom, and also for cleaning and disinfection control. And you need a checklist for your toilets and your waste management. So, and just have in mind only what gets measured gets done. So if there is no clear, the checklist will also help people to orient them and not to repeat that every day, or it's much easier to just have checklist systems. And of course, see that you within the community establish, and in the school community and the community around surrounding the school, culture of hygiene, which means that you can have hygiene champions in the community, and that you emphasize teaching and non-teaching staff are part of this entire team, and establish and give very much importance to hygiene. This group is currently also working on checklists, so that could be blueprints, and there will be soon also available on the respective websites, so that the checklists and also this action point, and also a so-called knowledge map, which Mohini will bring up soon, is available online, and school heads or ministries of education or organizations can download that and see how they will perhaps might fine-tune this, but this gives a global direction. And with this, I think I end. You can also on this map see on this one page, you also have a link to this entire map, which Mohini is representing or presenting soon. So this is basically a good orientation on how to manage on school ground. And it's mainstreaming the activities of various organizations. Yes, thank you.
Thank you very much, Bella. Bella, we can stay on your screen if you want, and if you just click over to your other Adobe document, I see the knowledge map is right there, or we can go to Mohini and she can.
Sure. Actually, Doug, if you don't mind, I'll share my screen because I'd like to talk about the knowledge map and another interagency document. And so I have those two pulled up.
Okay, Bella, if you can, you should have a place where you stop sharing your screen. There we go.
Yeah, I did that. Okay, yeah, thank you so much. I'm open for questions, I think.
Thank you so much, Bella. And I just want to also congratulate Bella and GIZ for really spearheading the partnership for the network. They've been really front and center for what we've been able to produce in terms of very quick, practical guidance. As you saw on the 10 action points for school heads, which we've got a lot of responses to after posting it on Susanna, the link that's in the chat box. People have come forward from several different countries saying, we would like to translate this. This is so practical. We'd like to work with you on that. They volunteered, and so we're now looking at that as a next step for where, government guidance is there, but, what does it come down to, the real practicalities at a local school level. This one pager is something that really speaks to those points and can be put up on a school principal's office or handed out to teachers, talked about at assembly and so forth, to make it actionable with whatever resources they have. Coming now to the knowledge map, and this was our first undertaking as the network. It was really in the early days of when global lockdowns had happened. Over 90% of the schools were shut, and there was critical need for information to bust a lot of the myths that were out there around COVID-19. And as we were still trying to understand what does it mean in terms of disease prevention, control, what are the risks. So we developed this knowledge map of IEC material, which looked at two parts, one being the support during school closures, and then the second being getting ready for school reopening. This document, which is on Susanna, is version 3 of what we brought out, and there's a version 4 coming up soon as we're starting to see, schools reopen, and it does need to update the materials in here. As Bella said, some core messages like we have in the action points are also here, but it's more a behavior change. What do you need to do really, very specifically, as a learner, as community members, as school officials. So very simple guidance around that. Washing your hands, covering your face. It's this page really. And then from there to then provide these materials at different levels for the education system and what IEC they could use. And it is multilingual, where we've had access to materials in different languages, along with specific guidance for learners at different levels and also for families. And a lot of these resources come from what's already been put out by, the Global Education Cluster, INEE, and other interagency groups. So we're essentially distilling from what's out there, like Bella was saying earlier, for overall response to COVID-19, but for a very specific Washington schools audience, and with a very specific goal of SDG 4A and meeting these minimum standards, if you like, to meet that SDG. So we didn't want to duplicate what's out there. We wanted to bring the collective knowledge that there is in the community and put these materials together. So there is an essentials list of materials, and then there is an additional list of materials. We're doing a little bit of a reformatting on this because some of the materials which is relevant for one target group is also relevant for another. So, what we're sharing with school principals and learners is also relevant to parents, for example, and what they would want to share with them. And you can see some familiar documents here, for each age group. I'll pause here. Do take a look at the materials. If you have materials that you've produced for your organization, would like for it to be featured, shoot us an email through the Susanna link. We'd love to hear from you. To the next document, Doug, let me know how much time I have, and I'll be very brief.
Sure, go ahead. Yep. A couple of minutes, if you could.
Okay, thank you so much. The second document is really a complement to what's come out from the UN framework on safe return to school from a very, again, practitioner's lens, from a perspective of school heads as well as project or district stakeholders. It's an interagency document developed by the Global Education Cluster and the CPGPC. That includes several organizations that are on this call, as well as others. And it is an intersectoral document, but front and center of this guidance, and it is refreshing to see it, and we're on a fresh webinar, so pardon the pun, but it is nice to see that, the healthy to learn is like the first thing that one looks at when you open this document. The health and nutrition piece is what's covered given the nature of the current times. And then we look at, okay, once we're creating that environment, that supportive environment for well-being of learners, of school populations, what do we need to do in terms of education, their protection, their mental health, well-being. So this document, and I'm sorry, I'm just scrolling through it very quickly, but I wanted to get to this part of, again, it is organized in a similar fashion to the other documents of before schools open, what are the practical actions one needs to take in terms of health, nutrition, and WASH. And then once they're open, what does it entail? Again, a very bold and clear action points, checklist items of what needs to happen in terms of cleaning, disinfection, engaging the whole school community, considering gender and being gender transformative in our approaches, ensuring the hardware facilities for hygiene are available, adequate, and accessible, that they're age-friendly, and include not just the facilities, but the messages that go with it. We're not forgetting about the food preparation and services, addition to school feeding, that go into preparing schools for reopening, because kids have been out of school, have been denied a lot of the services that are just considered as, a norm when schools are functional. And since as they're reopening, a lot of that needs like almost like a new academic year, and it will be a new academic year for many locations and preparations of schools. Then on to once schools are reopened, it's the same that you've seen also in Bella's presentation with the 10 action points, and there are references to that document here, and there are other references too around cleaning, disinfection, menstrual health, hygiene, and nutrition. Apologies, my computer was about to run out of juice. And the education around that, overall ventilation, school canteens. And another critical piece that we tend to forget sometimes is the close link between well-being and what one sees in terms of students' attendance and participation, and monitoring absences and implementing measures to manage and prevent those risks are even more so relevant now, because we do want to promote health and well-being. If children or their family members are sick for whatever reason, that they have the time to recover, and there are tools to capture that information and make localized decisions on a student, school, or district level. So we've talked about this digitized tool here, Waliku, that Save the Children leads on and has developed, and also about how do you mitigate for future outbreaks in terms of keeping school facilities clean and away from risk. Doug, over to you.
Great, thank you. If you can, yeah, that's great. And I'll just reload the slides, and we have one more presentation, then we'll have some time for discussion. We scheduled this for 90 minutes, and we can push into our business part of the meeting as well. So I'm just going to share the slides again as my computer works on it there. Okay. Okay, that should be uploading. And for any questions or comments for Bella or Mohini as we wait for this the last set of slides to come up, just click on your mic and introduce yourself and say hello. If or even the other presentations, if you want to take this moment while we wait for the slides to be uploaded. I see there's been a lot of dialogue in the box about different documents. We'll make sure that we have all of them listed in the FRESH website webinars page. So we'll be able to make sure that you have that. And maybe we can work. I know the UNESCO Health Education Clearinghouse has been keeping tabs on a lot of this. Maybe we can sort out a little map with them so we can make sure that it's on our website and you can click into there. So I'm just going to go to the final presenter, Mervat from WHO. And Mervat, if you just want to ask me to advance the slides when you're ready, that would be great.
Thank you, Doug. Good day for every one of you. I'm Mervat from WHO Regional Headquarter Office. Next, please, Doug. Actually, the WHO programs responsible for COVID-19 are operational from prevention through preparedness to early warning response and earlier recovery of the pandemic. Several documents have been several IEC materials and guidelines, and they're developed and updated since the crisis emerged. I will focus here on some documents which are related to children and school context and released on global level. This one is an interim guidance for COVID prevention and control in schools. It has been developed jointly with the interagency standing committee between UNICEF, IFRC, and WHO. The purpose of the document is to provide clear and practical guide for safe operation through all phases of the pandemic in schools. The document addresses students to encourage them to become advocates for disease prevention and control at home, schools, and communities. The document is targeting school admin, teachers, and staff, and parents and caregivers and community members as well. Next, please, Doc. About risk communication and community engagement, and jointly with UNICEF and IFRC, WHO developed this tool to support staff responsible for risk communication and community engagement, to develop an action plan, how to implement this action plan, how to monitor it, with an aim to prepare and protect individuals and families and communities during the early response to COVID-19. Of course, the plan is to be tailored according to each country context. Next, please. So, several technical guidance and service-related documents have been developed. From this guidance, this one is on providing universal access to public hand hygiene stations on obligatory basis on entering and leaving any public or private commercial building, includes schools and health facilities. Next, please. This guidance is exploring the contamination of services by COVID-19 virus, the persistence of virus on different services, and the use of chlorine-based products as disinfectants. It described that spraying disinfectant are not recommended, as it is not effective. Moreover, it can result in risks to the eye and can induce respiratory and skin irritation. In schools, it's important to identify the high-touch surfaces and disinfect accordingly, as our colleagues mentioned. The document also ensure how the personal safety and when preparing and use the disinfectant. Next, please. This interim guidance discussed the measures to keep water supply safe. It presents wash practices such as hand hygiene, general recommendation, hand hygiene material, water quantity and quality for hand washing, and hand washing facility options. Next, please. About this interim guidance, it was developed jointly with FAO, WHO. The guidance aims to address how to ensure effectiveness of food safety inspection program in mitigating risk, how to introduce temporary measures to contain food safety risks. Of course, this cannot be done except through multi-agency cooperation. Next, please. A guidance was developed on consideration in adjusting public health and social measures in the context of COVID-19. This annex is tailored to school context. So the document focus on what should be considered to close or reopen school, as it has to be guided by risk-based approach to maximize the educational and health benefits, both of them, for not only students, but teachers and staff as well, and community at large, putting into consideration that the local situation and the epidemiology of COVID-19 may vary from one place to another, even within the same country. This guidance highlights school setting and its ability to maintain COVID-19 prevention and control measures in terms of policies, practices, infrastructures, as our colleagues mentioned, behavioral aspects, for instance, the young students and their adherence to physical distancing. Another factor is the safety and security, such as school meals, about the availability of enough staff to run the school, etc. The document described the recommended measures for school reopening, not only the hygiene, but how to daily screen temperature for children, how to deal with the student and the staff in case they encountered symptoms of COVID-19, how to communicate with parents and the students, how to monitor school after reopening. Next, please, Doc. As we all know, WHO highlighted 6 conditions to be fulfilled before easing the restriction. One of them is that school, which is the 5th one, the schools have established preventive measures. And the 6th one is the communities are fully educated, engaged, and empowered to live the new normal. The new normal is a new term we all use now. May I have the next, please, Doc? This one, as we all know, the pandemic has a devastating impact on health. It exposed children, as we all know, to increased risk of violence, as mentioned by all my colleagues in their previous speeches. The leaders for organization committed to ending violence against children. They came in solidarity to call for action, pledge support to protect children from violence. This advocacy document is a joint leader statement against this hidden crisis of COVID-19, which is the violence against children. Next, please. Deepika asked me to put this slide. Now we are currently working, UNICEF, WFP, UNESCO, and WHO. We are embarking on developing a comprehensive practical tool on schools' response to COVID-19 in all phases of the crisis: preparedness, response, and recovery part. We are working on the 0 draft of the framework, and we will share with you the framework once finalized for your kind feedback. Next, please. I will end my presentation by this story, My Hero Is You, which is developed in collaboration with more than 50 organizations, with the interagency, WHO, UNICEF, UNHCR, Red Cross and Red Crescent, Save the Children. Actually, more than 1,700 children, parents, caregivers shared by their experiences on coping with COVID-19 pandemic. They shared this in developing this story. So this is who developed and how was developed. Next, please. Now for what? Or the key messages. The key messages are you are a hero, you can fight, some info about the disease, physical distance, banning cross-border travels. It tackles some psychological mental points, such as how to relax when you feel scared, as it was mentioned by Antonia in the beginning. How to create safe place when you feel sad or afraid. Next, please. How to communicate with seniors, grandpa and grandma. How to do when someone in your family got sick, how to spend time at home, cough etiquette. It has a very good point. The feeling of a child who experienced COVID-19 before, how to protect others. Next, please. And for where this is about the dissemination. The dissemination is global. Actually, it has been translated till now to 83 languages. And on the website, there is a public reading of the story by Howard Donald. There are lots of IEC material and documents, but I just choose these for you, and thank you so much.
Thank you, Mervat, and I'll just go to the last slide, and there we are from WHO. And just as we start to look for discussion and questions, one of the things that came to me as we close with the student's perspective or the child's perspective and Antonio's initial presentation looking at the teacher's perspective, I hope we kind of keep those frontline views foremost as we work through all these guidance documents. It's really important, I think, to sort this out from those two perspectives, the kids and the teachers, very important. So questions and comments, just click on your mic and ask any of the speakers to respond. We are running about 9 minutes over, but we do have another bit of time as we schedule a longer coordinating committee call. So there was a couple of comments about not being able to see the slides. We'll make sure the slides are posted on the Fresh Webinars page and also elsewhere if people can do it. And I'll see if we can work with others to do a bit of a roadmap. Perhaps the document that Mervat referred to near the end of her remarks, if there's a comprehensive document being prepared, then that might be the best place to make sure everybody gets a copy of that. So questions or comments as we move to close up the session? There's lots of links being shared, and Ruth is, so I'm just going to see if there's any questions that are, lots of links. We'll make sure they're in the session description on the webinars page. Anything that is jumping off the pages or the slides or from your own experience of what's missing? Is there anything that in this many documents and guidelines being prepared, are we missing anything as we start to move to the new normal, as many people have referred to it?
Hello, Doc. This is Emily Sidaner. Since the PICA couldn't join the call, I was just wondering if you had a flavor of what she would have shared about what UNICEF is doing.
Yeah, there was a document that UNICEF and others were have prepared. It's kind of a really good map of the decisions that countries will make. It is in the session description already on the Fresh Webinars page, and we'll make sure that you have a chance to read through it. I was trying to organize the material starting with the Education International document as a set of principles. I think those are really good principles that sort of flow through everything else we saw today or heard today. And then the second document, which is the PICA and others have been working on, which is a kind of a checklist of the country's decisions that need to be made, is also a really good framework document for addressing all these materials. And then driving down into things such as the hygiene and putting into the WASH program context and putting into a safety context. Those are all really important focal points that we need to consider as we move forward. And then the teaching and learning, and I really like the second to last page here. The key messages in this storybook I thought were very good to talk about. I'm just going to go back up to the agenda slide, but I think the messages in that storybook are the kinds of messages that the children are asking. Those are the questions they're asking, and so it was a good reminder. So we'll make sure we've got all this in a map format, and again, call for any other further questions or comments before we move back to our regular agenda.